Hello.
Hey, good morning, good afternoon, good evening, everyone.
Hi, sir.
Hey, hi Dipti. How are you?
I'm doing good. Thank you. How are you doing?
I'm also fine.
Sir, shall I start or we should wait for 5 minutes?
Maybe we'll give 1 or 2 more minutes and then we'll start.
Okay.
I think we can get started. Otherwise, because it's just a 1 hour session, right? So,
Okay. So, hello everyone. I am Dipti from the team of GISA Council. I welcome you all to the webinar of HIPAA at Home Securing ePHI in a Remote and Telehealth World conducted by GISA Council. It is a not for profit organization committed to empowering individuals and organizations through specialized training and globally recognized certifications. Our mission is to strengthen the cybersecurity and IT governance ecosystem by building skilled professionals through programs such as PCI HIPAA, ISA, CISA, CSIM, C-Risk Prep Trainings, ISO 27001, SOC 2 Type 2 Auditing Program, and many more. Director Dr. Hiral Patel has over 17 years of global experience in IT and cybersecurity as a consultant and lead auditor. She is passionate about mentoring and guiding professionals in building successful careers in information system, audit, risk, and cybersecurity. In just more than 3 years since our establishment, GISA Council has proudly trained over 5,000 plus professionals across 60 plus countries, including participants from 170 plus global enterprises with more than 30 Fortune 500 companies among them. I am delighted to introduce Mr. Pradeep, a highly experienced trainer with 28 years of industry experience, including 22 years in information security and cybersecurity. He has worked with Fortune 100 clients across BFSI, ITES, telecom, and healthcare with expertise in risk management, IT governance, BCPTR, and compliance frameworks such as ISO 27001, PCI DSS, SOC 2, HIPAA, and GDPR. Best wishes to all the participants. Thank you, sir. Over to you.
Hey, thank you, Dipti. Hey, hi everyone. So today, as Dipti mentioned, we will look at the, you know, it's just a 1 hour webinar where we will look at the uh, one part of HIPAA. Okay, so now that the whole ecosystem is changing, it's just not uh, that people are working from offices. The people are also working from home where they are accessing a lot of PII information. And as part of that, one such segment is with regards to the healthcare information. So from that perspective, we are just going to, have a session where we will cover things around how HIPAA is managed from a work at home environment. So that is the whole crux of this webinar. Uh, so as part of that, uh, you know, we would look at how the whole journey of protecting the ePHI information, which is nothing but the electronic protected health information, across this new landscape that is there. I wouldn't say it's new anymore, but yes, uh, it did become one of the landscapes where uh, the healthcare information is either stored, processed, and viewed. So, so on basis of that, we would see it from a certain some main pillars, which is like from a virtual clinic risk point of view, then home office security, then incident response, because from a HIPAA perspective, uh, incident response is one of the key elements or key controls. And we will also look at some device and communication compliance standpoint. So this is what we are going to cover in the next 1 hour. Okay. So at any point in time, if there is any questions, we can take it up. But since we have a time crunch, we will see how much we can cover in that time period. Okay. And before we get to the topic, I just want to know in general if anybody has worked on HIPAA or been part of HIPAA audits, uh, or have any kind of uh, understanding of the whole standard. Or it's not a standard; it's a regulation. So yeah.
I've been part of course, I never did the audit, but I have some pretty good idea about HIPAA because
Okay.
LI Lilly, there is a company called LA Lilly, which is a major health company in the US. So we kind of did some kind of consulting. So I think any major health organization should really go with these norms and basic. I think it should have the basic bells and whistles. So I have. So I think I heard like ePHI and all that stuff.
Okay.
Yeah. I think some fair omnibus enforcement rule. I had like little bit, and it's about patient's responsibility and privacy, and sensitive data versus non-sensitive data, and how it basically. Yeah, I have some idea, but I never did the audit to be honest.
Okay, Venkat.
Mhm.
Yeah,
Hello,
Rashmi. Yeah,
I'm
Rashmi.
me. I'm from Bangalore. I work for an IT services company. I am the compliance manager here, and we deal with many healthcare IT engagements. So, in lieu of that, we were supposed to come up with, you know, being, calling ourselves a HIPAA compliant company. So for that, the necessary HIPAA implementation kit I have developed recently. I am aware of the nitty-gritties of HIPAA, but however, I have never conducted an audit or so. I am an ISO 27000 lead auditor too. I am more interested to deep dive into this HIPAA implementation and audits because I also have a life sciences domain expertise. So this is
Okay.
about me.
Okay. I have something for you when we go along. Okay.
Okay.
So we'll look into that. And so I think we will go ahead. So just to, just before getting into the topic of HIPAA at home, we will just look at what HIPAA is in general. Okay. So from that perspective, HIPAA stands for Health Insurance Portability and Accountability Act. So which was actually uh, you know came into existence in around 1996. So it established the core national standard for protecting sensitive patient health information. Here, in the US, primarily in the US, but the technologies have evolved, the ecosystem has evolved, the complexities and the uh, boundaries have grown. So from that perspective, uh, you know, uh, from a compliance standpoint, there are three major legal pillars, in which first one is the privacy rule. Okay, uh, basically think of this as who, which means it dictates exactly who is permitted to access, see, or share a patient's protected health information. Next is the security rule. Uh, so, if the privacy rule was about who, the security rule is about how. So, which means it outlines the administrative, physical, and technical safeguards required to specifically secure the electronic PHI information. Okay, so that is what the security rule governs. Then you have the breach notification. This is more from an accountability point of view. Uh, Basically, if things go wrong, it mandates that the notification with artifacts regarding patients and the Department of Health and Human Services are notified within 60 days of discovery of data breach. So that is one of the key elements where it clearly states that you need to notify any of the breach within 60 days of happening. Okay. So why all these things are required? Because if anyone in the organization or basically if we are wondering whether you know whether the compliance is an administrative formality or a critical business risk, then the number that you see there, the $14.4 million, that is the kind of fine that is the kind of penalty. Basically it's an average number, so it's an average penalty from a financial standpoint, okay, which is implied if the uh, compliance is not met, or in case the notification doesn't go on time, there is some breach, you don't notify, so the penalty can go even up to 14.4 million. Okay, so basically considering all these penalties is you know one, the organization, it is too much of a financial burden on an organization. And the other thing is, from a patient standpoint, it's for sure, if some healthcare or health related organization comes up with this kind of a breach, they would surely, lose trust on the provider or the company which they are associated with. So there is always a high possibility of losing customers. So from that standpoint, it is very important for any organization which is, re- you know, relating or utilizing healthcare related information to be compliant with HIPAA requirements. Uh, because the in case it's not there, then the chances of having penalties put on the organization is pretty huge, and it also hampers the reputation of the organization. Okay, so this is a base idea of what HIPAA is all about. Then we will look at some of the key security requirements. Okay, so basically it is to prevent the catastrophic penalties which are there. So the security rule enforces to balance three distinct categories to safeguard the healthcare information. So, so the three categories which would be administrative, physical, and technical. So on the administrative side, it is more about governance. Uh, we, so for which we would be conducting routine risk analysis, deploying workforce training programs, write access policies, and designate a formal security officer. So, so this will ensure the governance of the whole HIPAA structure that has been implemented. Then, from a physical standpoint, you know, we can ensure that unauthorized people cannot have access to the environment or the systems which either processes or stores or these healthcare information. uh, and then uh, as part of that, it covers facilities control, workstation rules, device management, visitor logs, and also enforcing clean desk related environment. So if you really align it with the other standards which are there, like you have ISO, you have PCI, yeah, and if you really align it, physical security controls are generally in similar in nature. So you'll cover things around the how access is granted to a physical floor, who is being granted access, what as per their roles and responsibilities. They will have access to certain levels of within the floor. And then it also talks about the visitor log, so where it will be about escorting, then maintaining the visitor logs, and then things are on the clean desk. I think that is also there as part of ISO. So and also from a contractual standpoint also, if you are an outsourced unit supporting uh, a, a hospital or something, in terms of the back end process. So there, if you see, they will ensure that you have a clean desk policy implemented, which means you might not have access to pen and paper. Then you would not have sticky notes and all that.
American company కూడా audit చేయొచ్చు.
Is there any question, please?
Information system audits.
Okay. So that's from the physical control point of view. Yeah, Venkat.
I'm sorry, yeah, I don't want to derail the whole topic, but quick question. So we all knew that this is completely related to healthcare industry, right? In terms of audit process, the controls, is it like how far it is completely different from the IS audits that we do? What is the real
Yeah,
significant difference?
there is no such difference as this, maybe the criterias. So that is something which I'll be covering in detail. There's a program. So
Uh-huh.
as part of that, I would be covering that. Okay,
Gotcha.
but to be on a high level, there is, see, physical security controls from any perspective. If you, even if you see from PCI standpoint or from ISO standpoint, it is similar. It's
Mhm.
maybe the durations might change, the log retention might change. So that these are some of the changes that would happen.
Mhm.
Otherwise, from a control standpoint, it's going to be the same.
Okay, got it. Thank you, sir.
Yeah. Then lastly, we have the technical controls. Okay, so this is we can call it like a digital armor. So from that standpoint, you will have access control from a logical access control standpoint, where I think again there will be a lot of similarities here also, like having unique user ID and unique password, multi-factor authentication, because now that you're moving away from a brick and mortar environment to to your own drawing rooms, or it could be home offices. So from that standpoint, multi-factor authentication comes into picture. Then the audit logging to track what is being accessed, what has been done, who is touching on the information, is someone modifying the information, is something getting added. So all those things will be tracked as part of log monitoring. Then in case of machine is idle for some time, then automatic log off should be given that. So that is also there as part of any other standard. Then you have integrity controls, which means the ePHI file integrity needs to be taken care of. So in term, it could be through DLP, or it could be from a file integrity monitoring point of view. Okay, it could be a FIM. Uh, okay, so one of these solutions can take care of all those activities. So this is on a very high level what the security rule covers. So it has three major categories, and under the three categories there are defined controls. On a very high level, these are the ones. Okay, but apart from that, it talks about the uh, extensively around the uh, from a governance standpoint, and then from physical security standpoint, and from a technical standpoint. So, just to give one insight on encryption, okay, so uh, as a practice, you need to have AES 256 and above when the data is stored at rest. And if it is transmitted, you should have TLS 1.2 and above. And TLS 1.2 and above is also the norm from PCI standpoint also. Okay, so yeah, so that is about the security requirements. Okay, next we will see about who must comply. Okay, so
Sorry to interrupt, Mr. Pradeep.
yeah.
Okay, just I do have a doubt here.
Mhm,
Okay, as you said that there'll be a penalty charge if they leak the members' information, right?
mhm. In
Okay,
case of a
so
breach, in case
uh,
of a breach, and if it has been not notified in 60 days time.
okay, so just it's applied to the physician side or it applies toward to the payers as well?
See, see, the payer could be the customer, right?
Yeah.
When you say payer, so it's basically it applies to
Yeah.
the organization who is consuming that information. Yeah, Venkat, were you saying something?
Yeah, I think it's more of like insurance companies and especially even the hospitals.
Okay.
Even as a matter of fact, this is something funny. They don't even allow me to be with my daughter. Like when we go to the doctor's office, they'll ask my daughter can your father be sitting here? Can he listen to this? So it's to that level. I think in India, I think they don't even really ask, right? If we are not there, they'll ask you, where is your mom and dad, right? But here it's a different story. Like after certain age, they'll ask whether your mom or dad can he be here to listen to all this conversation. So usually I think this is applicable to the organization, whoever is keeping that sensitive data, I think.
Yeah.
Whether it's
So
hospitals or medical office or insurance company.
that's right. So from see, you'll never apply such things on your customer. Okay, because they are visiting the hospitals or they are uh, you know uh, approaching an insurance company for certain uh, for a coverage or some kind of a medical thing. So from that point of view, the person who is going is a customer. So customer is never liable. It is the organization who are consuming that information, and if there is a breach over there, is where they become liable. So so from that perspective, the next slide, if you see who must comply. Okay, so from that
Thank you.
perspective, yeah, yes, Sunita. So so who must comply? It covers, which are the entities which should oblige to the HIPAA requirements. Okay, so from that perspective, first one is CE, which is the covered entity. Okay, these are frontline stakeholders like hospitals, clinics, health insurance plans, then the clearing houses. Okay, clearing houses, I think they are the individuals who deal with insurance claims, if I'm right. Okay, so they must comply fully with all the three rules. So if you remember, the three rules are these: privacy, security, and breach notification. Okay, so from that perspective, the covered entities need to ensure that they are complying to all the three rules. Then you have business associates, that is BA. So if a covered entity hires a third party organization that touches, stores, hosts, or transmits ePHI, that vendor becomes a business associate. So it is basically a third party vendor uh, who is basically having access to the healthcare information, either to process or store, as it's been mentions, host or transmit. Okay, then this includes electronic health record vendors, then medical billing firms, then cloud storage providers. So they all fall under these buckets. Okay, and they are legally required to sign a business associate agreement, and they are directly liable under the security rules. Okay, so which means that they need to have a business associate agreement. So that would be covered as part of the larger program on what goes into the business associate agreement. But on a very high level, if you see, it will be talking about what kind of service they are going to provide, what are the compliance requirements they need to have, and from a service rule or a privacy rule point of view, what they need to implement as part of that process. So that is what will go as part of the if you fall under the business associate bucket. Then lastly, you have sub BA. Okay, so sub BA is nothing but but a subcontractor. So if the cloud storage vendor hires an offshore support team or a specialized data analytics kind of a sub-processor that interacts with the data stream, then they are uh, they are termed as subcontractors. So basically, it is like uh, you have the main entity. If they are you know engaging a third party, they are business associates, and if they are engaging a vendor to do a certain activity like maybe data analytics or some kind of offshore support kind of a thing, like a backend support kind of a thing. Okay, so these uh, organizations are called sub BA, which is subcontractor. Okay, so it is like BA of BA. Okay, it is something like that. Okay, so a chain, the chain is only where this is required, and also as part of this, they do have contracts, and they need to ensure that they have similar controls implemented, as a BA, that is the business associate related organizations have. So generally, as an example, if you see, it is generally your BPOs and KPOs who do backend processes. Hello. Yeah. So it is basically, these organizations which will fall under that category. Okay. Yeah, Mohammed.
Thank you, sir, for having me here. I have a question regarding the statement of or scope of applicability. As we've learned that there are three kind of organizations: covered entity, business associates, and the subcontractors. So, is there a regulation or scope of applicability? For example, for the covered entities, they have to comply the full controls of HIPAA, and business associate may have some partial controls.
Yeah. So as I mentioned, covered entities, they need to have all the three rules implemented within their ecosystem. Okay. Business associates, sorry, they would have a business associate agreement signed with the covered entity, and they primarily would be implementing the security rules and privacy rules. Not in complete, but certain part of privacy rules will be applicable to them. Okay, because they will also have visibility to data. Okay, and in case of a subcontractor, they will also have similar kind of uh, requirement as a business associate, because it is just like they are an extension to business associate. So they will also have visibility. So based on the visibility they get, the either security rules or some part of privacy rules will be applicable to them.
Right. One more question. For example, a company that is a covered entity, and the company hires a IT security provider to implement the encryption, for example. So,
Mhm.
would it be the subcontractor?
No, see, if the direct, then it will be a business associate. Okay,
Okay. Right.
so okay, again, it depends upon the, see, if you're talking about implementing encryption, right? Then it could be a subcontractor. Okay, because for a simple reason, they don't have direct access to any kind of healthcare information. It is just that they are enabling encryption on those systems. Okay, so from a business associate point of view, they will have access to the healthcare information.
Okay. Thank you.
Yeah.
A quick question, sir. So we have the subcontractor and BA of BA, right? For example, there's a parent company in the US and they gave it to offshore. For example, some company, XYZ company. Uh, of course, they have the MSA, Master Service Agreement, and all. Uh, uh, but if there is a breach happens at offshore level, who is liable?
They are also liable, and business associate also will become liable. So it say again, if any breach happens, then you have an investigation process.
Right.
So they will look at which point the information leak has happened, and basis that the penalties and all those things will come into applicability.
Mhm.
Okay, so that will depend. So it might be that the leak would have been at the business associate level. Okay,
Mhm.
it would not have affected from a subcontractor, because see, from a subcontractor level, generally, if you see from a say for example from a BPO standpoint, they would not store anything at their end. They might only have visibility to the data, but they might not store anything. They no nothing. Even the application they are accessing is hosted at the client end. So if
Mhm.
anything were to go wrong, it might have gone wrong at at the source, right? It will not happen from, and even if anything would have gone wrong from the subcontractor point of view,
Mhm.
okay, maybe if somebody got access to those system and through that they would have gone to the business associated related system, then the security breach or the weakness that is there. So as they say, it is always it is the chain is as strong as the weakest link, right? So the same way
Yeah.
it will work. So if the subcontractor did not implement security controls properly, through which the breach happened, then they would be liable. Okay, and
Mhm.
for business associate would be liable because they did not do the due diligence properly. So
Yeah.
from that point of view, they would also be liable. So it could be a chain. It would be a multi-chain effect in that ways.
Yeah. Thank you, sir.
Okay. Okay, and from our perspective, since we are looking from a work at home point of view, so uh, as the statement in the box says, the remote workers are workforce members of the covered entity. So HIPAA applies equally to people from who are working from homes. Okay, so which means that if I as a person is working on any healthcare related information, then if anything goes wrong from my system point of view, I can also be held responsible from that standpoint. Okay, so this is how we will define on who must comply. Okay, so and also that HIPAA doesn't care about your geographic location. So from that point of view, uh, the person who is accessing the information in the US or any part of the world, if there is a breach, if, where there's a compromise with the healthcare information, so anybody, irrespective of geography, would be liable for the from that perspective. Okay. So having said that, so this is the training program which I was talking about, which is to start from the 25th of July. Okay, so it's a 16-hour program where we will look at HIPAA from an implementation and from an auditor standpoint. Okay, so this is something which has been planned out. So you can touch base with one of the GISA Council members to see if you're interested and if you want to register for this program. Okay, so this is the brief about the program that I would be taking from the 25th of July, which I think is 1 week from now, to what I understand. Now coming to the topic of HIPAA at home. Okay, so we will look at uh, how this spans out. Okay, and as it says, this is the new boundaries. This has new risks associated with that. Okay, so if you were to break down, there are three primary vectors of vulnerabilities. In this virtual clinic space. One is the uncontrolled endpoints. Then next is the extended attack surface. and then the blurred physical boundaries. So, how many of you work, work from home?
Myself, sir.
Okay, okay.
I work in a
So,
hybrid mode.
hybrid. Okay. So, from that perspective, I think at some point in time, most of us uh, would have worked from home. So, you might relate to these terms. Okay. From an uncontrolled endpoint point of view, if you see in a traditional office perspective, IT configures every machines. At home, we suddenly see corporate system mixed with personal devices. You have your personal phone, then you have the shared family computers, unmanaged residential routers, processing sensitive information. So, all these things are part of a work, from a work from home perspective or from a home office perspective. Suddenly, you'll have your kids roaming around, looking at your system on to seeing what your parents, what parents are actually doing as something called work. So from that perspective, so that is why the whole environment, they say, and also since you have your phones around, there is always possibility. And and as a security person, I have seen a lot of instances. I have been part of a lot of policy violation related calls where people have tried to you know take the customer information and try to use it for their benefit and all that. So from that perspective, yes, the environment, as they say, is the endpoints are uncontrolled. But again, now we have mechanisms where we can, the organization who ensures that the camera is on all the time. Uh, you know, they also see if somebody is looking from behind. Sorry, and in case somebody is noting down information or something like that. There are ways to monitor that now. So, but yes, when initially it started, it was a little bit chaotic to what we can, if I could use that word, but now there are mechanisms, there are controls that are placed. So, so this is one of the risks because of the new boundaries that have come up till the houses, okay, or to the homes. Then with all these extensions, one thing that has happened is your attack surface is also uh, increased, which means that now you need not try to uh, get into the network of an organization where you might have perimeter level security controls. Then you will have internal security controls by having perimeter firewalls. You have IDS, IPSs. You have internal firewalls. You have different routers that would be there from an office standpoint. But when it comes to sorry, home offices, uh, the whole point is, if they are able to access the, the Wi-Fi, if they're able to crack the Wi-Fi access of the individual, if they're, if the chances of phishing, then the credential thefts, you know, the liability or the vulnerability and the exposure to these vulnerabilities are pretty much high in a work office, uh, the home office kind of a setup. So, so from that point of view, the attack surface is broadened. Okay, and then from a physical security standpoint, again, as I was mentioning, you have your family members suddenly barging in, or maybe your roommate, your neighbor. There are a lot of curious Georges around, so they would try to sneak in to see what is happening. So from that perspective, the the physical space is also, not that safe from not from perspective of our own safety, but from the perspective of the information that someone can read. So so that is also considered as a violation from a HIPAA point of view. So generally, if you see, if you have a HIPAA program, which is from a work at home point of view, they would have camera related controls implemented where you need to ensure that your camera is running all the time, and they have applications which there is I think there's an application called Sentinel, which monitors the work the individual does. And as an individual, I will not have the privilege to shut down that application. So which means it keeps monitoring. And then you have DLPs implemented to ensure that information is not mailed out. You'll have your email security implemented, internet related security implemented on those systems. And even if it is BOID, then you would have some kind of sometimes some kind of Citrix environment enabled, or virtual desktops been enabled, and which is pretty much controlled. So so this is the major, you can say, the major vulnerabilities or risks that is associated when it comes to virtual clinics. Okay, then you have some stats there. Okay, so if you really look at it, major part of the uh, breach, I wouldn't even say from a healthcare perspective, from any breach perspective, it is generally because of human error and you know people trying, falling to phishing attacks and all that stuff. So So that is one. And even from my experience point of view, I have audited processes which caters to healthcare, and I have seen situations during the audit when it was, work from office kind of a situation where the same credential was used by multiple individuals. Okay, so uh, in one case, the person forgot the password, so the account got locked, and they had some deliverables, so she was sharing the colleagues' credentials to continue with the work. So till the time her login was reinstated. But luckily for me, during the audit, I saw that thing happening. So which was one of the major findings that I gave. So that is one of the controls, and one of the ways where breach can happen and a person can get away from the whole thing. So that this keeps happening, then misplacing of your laptop, then leaving the system logged in. These are some of the human errors which are there. Uh, Lately, if you see, there has been 3 times the healthcare related companies have been targeted from a phishing attack standpoint. And this has been majorly post pandemic. Okay, so that is there, uh, and also around 68% of remote workers are using their own personal devices. Uh, so which is like the BOID model. So in those models, if the virtual desktops or the Citrix environments, you don't isolate them from the personal drives, then there is always a possibility of copy and paste that can happen. And this is something I have also seen in one of the recent audits that I did, where the data was accessible. The person was able to copy from a Citrix environment to their local desktop. So, okay, so all these things needs to be carefully analyzed, and basis which the controls needs to be uh, ensure that it's implemented accordingly. Okay. So the next set of controls are from physical and technical standpoint. Okay. So one of the ways you can ensure security, or uh, uh, can you just give me one sec? Okay. So just to continue, one of the things which as an home office kind of a setup you can ensure is to secure the home Wi-Fi, which means you change the default router passwords, you enable the WPA3 or WPA2, depending upon the uh, protocols that is there as part of your routers, to enable one of these. Okay, or anything higher than this is also fine. Okay, then create a dedicated VLAN versus a guest VLAN. So all these routers have the ability where you can have separate VLANs. So, so from a work perspective, you have a dedicated VLAN, so that whenever you get to your work environment, you connect to that VLAN, and your home PCs can connect to a different VLAN. Okay, then disable the Wi-Fi protected setups. Okay, you turn that off and turn on automatic firmware updates. Okay, so these are some of the things that can be taken care from a Wi-Fi setup point of view. And during your work hours, ensure from a physical security standpoint, okay, from a physical security standpoint, you can ensure that you have some kind of rules set with your family or roommates, depending on who you stay with, and make it very clear the sensitivity of the information that you are dealing with, and to ensure that uh, the privacy of that workspace is taken care of. Okay, then during calls, ensure that you have headphones you're using. Okay, then lock your systems. Okay, then maybe you can have some kind of a sign that you put it on your door when you're working on some critical engagement with regards to your healthcare information. Okay, so some of these things basically it can help in ensuring that the breaches can be minimized. Okay, then in case you are noting down something on paper, because it from a HIPAA standpoint, it doesn't say that you cannot write down information. But in case you are doing that, then you need to ensure that you have a cross-cut shredder also put in, kept around your workspace, so that you can shred it once the work is completed. Okay, so I think this is a basic requirement if you're having a home office kind of a setup. And so, yeah. Moving forward, then you have things around device and communication compliance. Okay, so there, uh, First is the BYOD, which is bring your own device. So where your device will be, your personal device would be used for, doing the work around where you might be dealing with the ePHI informations. Okay, so it has inherent risk because you will be able to do copy paste and all that stuff. So from that perspective, your personal apps, often scan and share device storages where the ePHI attachment might be downloaded. So if you lose your personal device, you know, and there could be a potential security risk. Okay, so they recommend that you have your company data, must be enrolled with the mobile device management, that is the MDM's platform, like you have your Microsoft Intune, okay, JAMF, are some of the tools that are used. Okay, so basically it will create a secure encrypted corporate container, so which means your office data will be isolated within that environment, and uh, it would be separated from your personal information. Okay, so this is from a BOYD point of view. Then you have telehealth compliance. Okay, so which means you cannot just hop on regular consumer video apps like FaceTime, Skype, or Discord. So basically, uh, the platform that you have should be legally should be as per the legal requirements from a HIPAA security standpoint. So uh, this requires two things. The vendor must sign a business associate agreement, as and should pursue to follow the federal laws, and the platform must support end-to-end encryption. Okay, and so that the IT team, can constantly audit these platforms and can ensure the virtual waiting rooms are logged down, the sessions are recorded, and you can have heavy restrictions put in place, and you can also have logging enabled on these systems. So what it only means is that when you're from a teleworking, no, telehealth compliance standpoint, it cannot be on any public communication systems. Okay, like your FaceTime or Skype, or you might have any kind of messaging applications, or it could be WhatsApp or any of those things. But it should be something which has end-to-end encryption, and also it is uh, a vendor which has signed a uh, BA agreement with as per the federal laws. So only those kind of communication or collaboration tools can be used. Then you have phishing and social engineering, which is a huge risk at this point in time, where people might try to pick on individuals to see if they can gather some kind of privileges, and they can try to gain access. So from that point of view is where multi-factor authentication comes into picture, where you need to implement multi-factor authentication to all clinical and admin accounts to ensure that only appropriate individuals have access, can gain access to these systems. Okay, so this is from the device and communication compliance standpoint. And I think one of the last topics would be around the from an incident response standpoint, because that is that is where it is related to the breach notification rule which is there. Okay, so they are very much the process around breach notification is very much focused uh, to an extent that if an incident occurs, uh, the isolation and isolating that environment and reporting needs to happen within an hour. So which means that you need to immediately disconnect the compromised device from your home network by turning off your Wi-Fi, unplugging your, the network cable, and they say that you do not uh, turn off your device completely, as the IT team, might require to run some kind of forensics from maybe from a server side. So from that point of view, okay, then reporting of these incidents should be done within an hour uh, to the IT system, IT security team, and the HIPAA security officer within your organization. So once this reporting is done, then the IT team gets into action by triggering the remote wipe. So since these devices are enrolled, be enrolled with some kind of an MDM kind of a system, so the security team will immediately issue a remote wipe command. This would basically wipe out all the hard drive, clean before the malicious attacker can crack the local password and extract patient records. Okay, so first is to isolate and report the incident within 1 hour. Next, the IT team has to get into action by doing a remote wipe. And then comes the factor of the breach assessment. Okay, so as part of that, the compliance team will immediately launch a formal risk assessment. Okay, then so it is uh, as per the 45 CFR. Okay, so then uh, the documents are then extracted, then extended to the extent of PHI, to understand what are the PHI information is involved. Then they would identify the unauthorized person who may be accessing it, then determine if the data is actually viewed or accessed. Uh, then if that is the case, then assess the mitigation levels. Okay, so this is the next level where the breach assessment would happen, and this would be primarily done by the compliance team. Then comes the process of the executing of the notification, which should be max within 60 days. Okay, so if the assessment confirms that the data breach occurred, uh, then uh, then the whole process of legal notification process starts, in which we must notify every single affected patient within. So, from who all would be notified? It will be the patients, uh, who have been affected. Along with that, you need to notify the federal government. Then, okay, and also note that if the breach impacts 500 or more records, then then we are legally required to notify the local media outlets and the government officials. Okay, so that is also a catch. So if the impact is more than 500 or above, then media also comes into picture. Okay, along with the patients and also the healthcare department from a federal standpoint. Okay, so from that perspective, the things to remember is you have 1 hour to report to IT. they have 24 hours to start the whole formal risk assessment. And if a breach is identified, then there is a 60-day period for informing all the affected patients and also the government officials. Okay, and uh, in case it is 500 and above impacted individuals, then you need to also uh, notify the local media outlets. Yeah, Mohammed.
Sir, I have two questions. First question is, who is authorized to perform the breach assessment? HIPAA certified professionals or any like CDPO, for example, in a privacy department or privacy field, there is a CDPO. So is there any designated role within a company to hire to perform the breach assessment? This was the first question. The the second question is, although all the word had been changed that work from anywhere. So is there a need for the unified security policy that should be documented and communicated to all the people who are working from anywhere?
Yeah, from a policy standpoint, you can have a unified policy. You don't generally create policies as per the standards or regulation that you need to comply to. It would be the organization-wide policies, and yes, it has to be communicated to all the employees, irrespective of where they're working from. And you will also have your awareness training where they'll talk about it. Okay, so that's the answer for your second question. From a first question point of view, it could be conducted by if you have a compliance team with people who have experience evaluating HIPAA-related risk assessments, they can perform. If not, you can engage a third party. So it's on the organization's capability.
It doesn't mean the company organization has the HIPAA certified professional or not.
No, it's not required. I don't think anybody will be. See, if I have done an audit, I am not HIPAA certified. Okay, so but I have the know-how of it, and I know what I need to check, and I have the knowledge of it. That is enough. And I have the experience of doing audits. Okay, so see, end of the day, irrespective of it being HIPAA or PCI or any other privacy standard, uh, the controls are more or less the same. Okay, so if you have the experience of doing the audits as per any, if you do, if you have the experience of doing an ISO audit, you can always do HIPAA also. It's just that you need to know HIPAA has certain timelines from a incident notification to breach notification. So those integrities you should be aware. Okay, and you will not have a separate risk assessment framework for HIPAA. You will be following your organization's risk assessment methodology, but it will also align to HIPAA requirements or healthcare informations. So that is how it will be. Yeah, Kunal.
Yeah, hi Pradeep. I have a single question. So since you said that HIPAA breach notification has an obligation, like regulatory obligation to notify the respective customers. So any incident you came across throughout your career? First question. Second question, is it applicable same across the globe, like for North American standards, for Asia and other regions as well?
So HIPAA is mainly for US hospitals or from a US healthcare ecosystem point of view. Okay, the other regions come to applicability if they are, like I had covered these things, right? If you are a covered entity or a business associate or a subcontractor, okay, from that perspective, HIPAA is applicable to you because there is visibility to healthcare information. Okay, but are the patients in these other geos covered from HIPAA point of view? No. It is only for patients who are there as part of the US region.
Okay, understood. And sorry if I missed that throughout the presentation. Like for ISO, we have a certain life cycle. Like once we get the certification, we'll have the surveillance audit, right? So
Yeah.
how's the life cycle works for this sort of certification for an organization?
To what so it's basically yearly assessment that happens. Okay, so because the technologies change, the complexities are changing, and even the standard point of view, there are some evolutions that keep happening. So from that point of view, it's an annual recertification that happens. It's
Understood.
not like it's not like ISO where you do 1 year now, then your surveillance audit, then the third year is your full audit again.
And sorry to
Understood.
interrupt, sir. Isn't it like there is nothing called a HIPAA certification? We can only be called
Yes,
HIPAA compliant, right?
compliant, absolutely. You're absolutely right. Uh, so, so it is not like a standard you certify against. It is the regulation that you are complying to. You're absolutely right.
It is an act.
Yeah, it is an act.
HIPAA Act. It
Yeah.
is an act.
So it is a
And yeah,
regulatory
it is not
requirement.
required when we generate the report. Is there any requirement of the CISA certified signature? Is there needed?
That I need to check. I am not able to recollect if somebody, but the assessor do signs off on it, so that much I am aware.
But if
So
the
What
assessor
should
is
be
not
the
as is,
credential of an assessor, sir?
yeah, it's
yes,
the assessor signs off on it. Yeah.
yeah, what the credential required for the assessor?
So there are multiple certifications, which is there as if you go to the HIPAA site, uh, from an eligibility point of view, there are multiple certifications. One of them, one sec, I'll tell you which that is.
Sir, as I think there is a list of some accredited firms or individuals that can perform the HIPAA assessment or HIPAA audit on the behalf of HIPAA company.
Yeah, that is so. Is generally an organization that comes, they'll send one of the individuals to do the audit, and to not certify, to give like a compliance this one. So you have something called CHSE. Okay, that's one of the certificate. Okay, I think that is certified health security expert or something like that. It is. Okay, so this has been provided by the HIPAA. So you can have look at details around that. It is called CHSE. Okay, so
Yes,
okay.
the internal audit can be done by any qualified person who has even not,
Yeah.
yes, even not certified professional. However, he can be competent in the field. However, the compliance audit can be done by their authorized personnels.
Yeah, accredited institutions. It is same like how PCI Council has QSA organizations who do the third party audits. So in the similar way. Okay.
Pradeep, just a follow-up question. Like you said, there is no, the life cycle of certification. So in that case, how do the regulatory authority make sure that this organization is, standing with the latest standards?
So, see, if you are dealing with HIPAA related information, then as a regulatory requirement, you need to be compliant to HIPAA, uh, you know, rules. Okay, depending upon if you are a, covered entity or a business associate or a subcontractor. So it is a mandatory requirement that you need to be compliant to HIPAA compliance or
No,
HIPAA requirements.
I got that. What my question is, like, for instance, I have seen, performing surveillance audit like for ISO, like on paper they claim, for instance, log management is being performed, but when we do the actual control check or the field work, we come across many instances where it's not being performed. It's just on paper. So that's
No, that
that's the
happen here.
question. Like, how do they make sure that these standards are adhered properly?
No, see, that cannot happen because you need to have the compliance. Otherwise, you will not be given access to the information itself. So you, only if you showcase the compliance is where you can deal with the healthcare information. Otherwise, you will not be even liable to give that service.
Correct. I'm asking post that claim or that's compliance. Like once the HIPAA is achieved, how do they make sure that they are
But
still, adhering the standards?
as I said, it's not a one-time activity. You have yearly assessments that happen. So you'll have a assessment calendar around it. So it's an yearly activity, and when the next cycle comes, the same checks do happen.
Okay, and that is conducted by internal audit team or the regulatory authority?
So the external audits are generally done by the authorized vendors. Okay, and from an internal check point of view, your internal audit team can perform this activity.
Understood. And the standard does say that you have an obligation to do this yearly or let's say half yearly or something like that?
Yearly is what I am aware of because that is what we follow in my organization. So we have a yearly HIPAA related compliance assessment that happens where the third party comes and does the assessment. Okay, and basis that is when the continuity of business happens.
Understood.
Okay. Sir, I have a question. Can I?
Yeah.
Thank you. As the covered entity has the full responsibility and full coverage of the HIPAA compliance, so do any responsibility falls to the covered entity, whether the business associate or subcontractors are not complying the HIPAA mandates? So do the covered entity ask to the subcontractors or other business
Yeah,
partners?
it is like any third party vendor, right? See, they are third party vendors. So from that point of view, you will have your BBA. BBA will, no, BAA, sorry, not BBA. BAA, which is the business associate agreement. So that will cover all the requirements that they need to comply to, depending on the kind of information they have access to.
Yes, yes. But my question was whether the covered entity may initiate a sudden audit to the business associate or the subcontractors on their behalf.
Yeah, because that will be part of their annual due diligence, right?
Yes, because after all, the covered entity is the sole responsible for the audit success.
That's right.
Right. Thank you.
Yeah. So basically, this is what was the intended coverage for today's session. Okay, from a HIPAA standpoint, from a home working environment standpoint, what are the key requirements? Okay, so that is what we covered during this session. So as I mentioned, this is something which is coming up. Okay, so where I will run through the implementation and the uh, auditing, how to audit these requirements. So it is basically from the security rule standpoint. So we might not dwell too in depth from the point of view of uh, you know the from us basically this is what we would be covering as part of the training in a very detailed manner. Okay, and uh, I'll see if I can touch upon the things around uh, the privacy and breach will be any which is covered because that is very much required. And we will also see from a privacy standpoint how the information needs to be secured. Okay, so basically this is whatever we saw in the initial three slides. Okay, so what is HIPAA, the security requirements, and who must comply? We will see that in detail during the 16-hour program, which is going to cover on the implementation and auditor cycle. Okay, for this, you can connect with the GISA Council members. They will help you out with that. So I hope this session was useful. Okay, and you did.
Sorry, can I ask you a question, please?
Yeah, please.
If a cloud provider stores an encrypted patient data, but find it difficult to decrypt it, does HIPAA still apply to that provider?
So what you're asking, if a cloud provider where the data is stored, they are not able to decrypt?
Yeah, the cloud provider was able to encrypt patient's data, but find it difficult to decrypt it. Does HIPAA still apply to that cloud provider?
But why should the cloud provider decrypt the data? That would be my first. They should not have the permission. See, cloud would be used to either
Storage.
store the information. So they would not be processing the information. So they should not be able to decrypt. If they are decrypting, then there is some issue in the whole process. So
But
maybe
again,
you
for that, Pradeep sir, so the encryption and decryption, right? Unless the data is really breached, do you think the encryption and decryption is under the scope of this audit or not?
no, it is part of the audit because it comes from a privacy standpoint and from data security standpoint,
Mm,
encryption is required.
mm,
Okay, so but for the question that was asked, ideally the cloud provider should not be able to decrypt because the whole purpose of using your cloud is either to store data and not to process that information. I hope
Sir,
I was able to answer the question.
I want to add one thing in this question and to the answer. Although the cloud provider holds the data and stores the data, he can get the expertise to decrypt. However, the cloud provider can be bound through any SLA or non-disclosure agreement in the contract. Yes.
Yeah, that will any
that
which
is
way will be
always
there.
there, but unless
Yeah.
there is a breach, that's what my question, sir. Unless there is a breach, how does it really kind of matter?
No, it matters. You see, the
Mhm.
whole point is if there is a breach, the data should not get exposed, right? So that is why you're
Yeah,
having
if there is
encryption.
a breach, yes, yeah.
If if there is
Mhm.
a breach,
Mhm.
again, you should give as much difficulty as possible for that person to get the data. So that
Mhm.
is why you are enabling the whole encryption on the data that you are storing.
Yes, after all the encryption keys are being managed by the customer, not the cloud service provider.
That's right.
Yes.
Okay. Is there any?
HIPAA and AI systems. We know we are in the era of AI systems. How does HIPAA address the use of AI systems that process electronic protected health information?
So from a bot standpoint, again, you will have similar controls. So uh, like it is a system which might be accessing some healthcare information to do some kind of processing. Okay, from that standpoint, you need to have a clear definition of what the AI system is going to do, what is the nature of the processes it is going to touch point. From a healthcare information point of view, since it's a PII information, then you need to have additional logging that needs to be done. I think Mohammed and Venkat should be able to answer this question because we were part of the session on ISO 42001. So it clearly defines, from an AI standpoint, these application you need to have an appropriate model card defined. Then you will have uh, clear definition of how these models are going to work, what is the input, what is the training process, what is the drift mechanisms. All these things will be there as part of that. So there are controls for it. Okay, so it is not that HIPAA is going to govern that, but you can have other systems to govern that also. I- So to what I understand, I think HIPAA also has points on securing the information by enabling the definitive model information, and uh, also from the kind of output it generates, the algorithms that have been used. So there are mechanisms for that as well.
Okay, thank you. I'm wondering, when you said ePHI is only applicable to US environment and third parties or sub-service organizations that works with health organizations in the US, what of participants that are outside the US that might not likely get maybe job opportunities with US organizations? Does that mean this HIPAA compliance session or training is not useful for such
Not
category of participants?
No, not like that. So when I said it is applicable to US, it is from the patients who are citizens of US. It's related to the securing the patient information uh, who are citizens of US. So it is basically, so say, so may I know from which country you belong to?
Nigeria?
Okay, so if you have an organization in Nigeria who is giving some kind of a back-end support to some US
Company.
hospital,
Yeah.
okay, some US hospital, okay, and aligning the insurance papers of patient or something like that. If such service is provided by a Nigerian company, they are liable, or they need to be HIPAA compliant to do that kind of an activity. So it does. See, it is not directly applicable to citizens of Nigeria. Okay, it is about the healthcare informations of citizens of US. Okay, which you are trying to help them in some kind of backend processing. Okay, so from that perspective, those organizations are also liable to be HIPAA compliant. So which means if you are someone who's expert in that field, you can provide those services to these organizations by ensuring implementation of HIPAA controls, or auditing from a HIPAA standpoint. So in that ways, you can do that activity.
Yeah, and I don't know if your curriculum for the training also covers third-party risk management, because the nature of the HIPAA, if not interrelating with, if not relating directly with health organizations in the US, you have to pass through third parties. Then they make third-party risk management quite important for
Yeah,
participants to know.
so that is also covered as part of the training, because I'm taking the training where I'll cover from an implementation standpoint and also from an auditor standpoint. So which means you will be able to help organizations in implementing HIPAA controls, and also you can help organization to validate the HIPAA controls.
And lastly, what has been the success rate of your training? What are your trainings achievements in terms of job opportunities? What have they been doing? How long does it take them after the training to get opportunities remotely or physically? What are the achievements of your trainees in terms of job opportunities and placements? And what are the type of roles that one can vie for or apply for after the training?
So once you do the training, you can write one of the exams that one of the certifications which I just mentioned some time back. Okay, so primarily that is something which you can target. Okay, so it is called CHSE. Okay, and so that is there, and see,
Sorry, can you repeat the certification?
it is CHSE. Okay.
Sir, is it like credited in the US or?
Yeah. It is a official certification from HIPAA.
Oh, okay.
Okay, I have put it on the chat. It is called CHSE. Okay, you can get yourself certified for that, which will enable you to be to showcase that you are a HIPAA security expert. Okay, and help you to do assessments, and also you can do internal assessments, and you can do gap assessments. You can be able to do implementations and all that. Okay, so that is what it will enable you to. See, job opportunities would depend upon the how much this act, or how many organizations are there within your country which provides HIPAA related services. Okay, if not remotely, yes, you can target to join. You can target to join any of the hospitals. Okay, or any of the like the roles that I showed you here, right? Any of these, it could be hospitals, clinics, you can be insurance companies, clearing houses. Okay, then you have the BPO setups which are there. So you can target all these companies to join. So see, the trainings that I take is more on knowledge sharing of what I have learned during my experiences. Okay, that is how I see it. Okay, and I'll give you guidance on what more you can do. Okay, and and then it is on you to create the opportunity for yourself. So I think there are some individuals here who have taken uh, uh, the previous sessions that I have taken. So and more or less, that is how my sessions are. It is more of information. Okay, and I share the knowledge that I have. Okay. If not, I think we have crossed the time. I look forward to see you on the sessions that I'm going to take on HIPAA. Thank you, everyone.
Thank you, sir.
Thank you, sir, for giving your time and giving us such information. Thank you very much.